Let's talk Medicare Advantage for 2025. This is the diagram that I use with everyone. And when it came to your two options, whether that be a supplement on the left or Medicare Advantage, you chose a Medicare Advantage plan as being the best match for your health, your lifestyle, and your finances. For 2025, we're seeing the insurance companies, as predicted, decrease benefits across the board. We're seeing this with every plan, every carrier. The most important consideration in choosing a Medicare plan is if you can go to the physicians and facilities you need to see in order to meet your healthcare needs now and in the foreseeable future. It's all about the network. Something that I've started adding just recently is that Medicare Advantage networks can change at any time during the year. We just went through another upheaval in terms of network when United Healthcare in July and August said we are negotiating with Health One, also known as HCA, and they may not be in network anymore as of September 1st. I think this is categorically wrong, that there should be legislation, regulation around this. We as consumers have to commit to an entire calendar year, and yet the insurance companies can change their networks at any time. It's just not right. The number of phone calls I got from 85-year-olds who depend upon Health One for all of their health care, and they had United Healthcare Medicare Advantage plans, was high. And it's egregious that we treat our older folks and all of us this way. So that's why I've added this little thing here saying that the networks can change at any time. It's not just United Healthcare. Humana went through this last November, right in the middle of open enrollment in terms of negotiating with Advent Health. So it can happen to anyone, to any of them. Here again, I'm using the same diagram that I've used for years. Going horizontally, we've got all of the healthcare systems. It's important to note it's not just hospitals. They also have primary care and specialists in the Advent Health, Common Spirit Health One, Intermountain, and UC Health systems. I've also added Denver Health, National Jewish, New West is a big thing, and Kaiser for folks. Simplistically, the more X's, the bigger the network. Going vertically, we have all the names of the insurance companies that are going to be offering Medicare Advantage plans in Denver Metro and most of Colorado for 2025. No change at all there. Select, second year in the market, it's still a small regional player. Same thing with Clear Spring. They're only in 3 states. So the network looks really large here, but I don't hear that many independent folks being contracted with Clear Spring. Nice people. I just am not sold on that. The reason I've highlighted Cigna down here is they've already announced that they are selling all aspects of their Medicaid business as of January 1st, 2026. And that includes their prescription drug coverage, their Medicare Advantage business, and their supplement business are all being sold to an affiliate, a subsidiary of Anthem called HCSC. So that is a red flag for me because I think their customer service is going to be degraded as we go through 2025 because those plans are going to go away and be transferred to HCSC as of January 1st, 2026. But we've got great stability. I tend to really gravitate toward Aetna, Humana, and United Healthcare because they're big national companies. They're contracted with all the players here in Denver Metro. So that's the HMO front. Then there are PPOs. Now, I do want to say a word here. As in an employer plan, we're really accustomed to wanting PPOs. Interestingly, the networks on employer plans are smaller than the Medicare Advantage networks. So if somebody comes to me and says, oh, I want to be in a PPO because I want options to go out of network, I'll say, okay, tell me who it is that you want to go to that is not covered on these Medicare Advantage networks. And they really can't come up with anybody. So on PPOs, all of the copays, all the maximum out-of-pockets are higher. And you may be doing that because of your perceptions with an employer plan that aren't true with Medicare Advantage. So just you have to step back a little bit from some preconceived notions that may not be true for Medicare Advantage, just so you know. Outside of Denver Metro, PPOs are a big player and very important. It's also a great option for people who are traveling from one state to another state, and for some reason they have not been able to qualify for a supplement. Okay. With Medicare Advantage, we start with the physician network, continuity of care. Want to make sure that you can see all the physicians that you need to see. And then we look at the prescription drug formularies, although this isn't a big differentiator as it was 10 years ago. And then those add-on benefits, they're all very similar. We're seeing a lot of cuts in terms of these ancillary benefits for 2025. This goes back to the Inflation Reduction Act and some of the constraints and what the insurance companies are losing in terms of prescription drugs. They're having to make up some of those financial losses by cutting other benefits. You'll probably already be looking, I hope, at your annual notice of change if you have a Medicare Advantage plan, so you can see the distinct changes between 2024 and 2025. I've already mentioned what's happening with Cigna. There are a couple other things that I do want to highlight. Aetna is pulling out their PPO $0 premium plan from just 2 counties, Arapahoe and Douglas. So that impacts quite a number of people here in Denver Metro. Anthem, we're continuing to see them really scale back on benefits. I haven't sold an Anthem Medicare Advantage plan in years, the last 2 years. So we're talking Medicare Advantage, not supplement. I still like Anthem for their supplement. But the maximum out of pocket on their HMO plan for 2025 is $9,350. It's unprecedented. So the signal that Anthem is giving to the market is that they really want people to get off from this plan. So we're going to see what happens in 2026, whether they sell their Medicare business to somebody else or because they're taking on Cigna's business. I don't know. There's something going on there. But if you happen to be on the Anthem HMO plan, you definitely want to get off from that. Another big change is, once again, United Healthcare is going through a renaming process. The 002 plan used to be their flagship product in terms of their HMO plan. They've now rebranded that as Essentials and really cut the benefits in that plan. They introduced the 005 plan in 2024, and that's become kind of their flagship product. And so they're cutting benefits on 002. So if you're on that HMO United Healthcare plan number 2, you probably want to get off from that. They've especially cut the dental benefits. So be aware. As I said last year, referrals from primary care providers are no longer needed to go to a specialist on any of these plans. TV commercials, the Part B Giveback. This is where they're trying to suck you in, have you call some 800 number. And in most instances, they're going to say, oh, I'm sorry you don't qualify for that plan, but let me tell you about this other plan that you'll really be interested in. It's a typical bait and switch. So don't get sucked into that because they just want to make a sale. If you tell them you're on United Healthcare Medicare Advantage, they're going to switch you to Humana. If you tell them you're on Humana, they'll switch you to Aetna. You know, it doesn't matter what the name is. They're going to switch you whether or not it's the best thing for you. So don't get sucked into those 800 numbers. It is not worth it. So a lot of the commercials talk about $0 premium, $0 this, $0 that, $100 back for rent, blah, 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 blah. Those are designed for people with Medicare and Medicaid. Okay, so that's an income qualifier for Medicaid. So that's not something you want to be playing with either. It's going to be a bait and switch. You're going to call because you're interested in 0000, and then they're going to try to switch you to a plan that's not right for you. Okay. The Part B Giveback is not as big a deal as it was 3, 4, 5 years ago, but here's the list of Medicare Advantage plans with the Part B Premium Giveback in Colorado for 2025. No need to call some 800 number. The primary emphasis is on veterans who have Medicare Advantage plans that don't have prescription drug coverage. And here you can see the list right here. Select devoted, larger Part B Giveback so that you're not paying as much on your Part B premium. Then there are a few plans for the rest of folks who do have prescription drug coverage. Devoted is looking at a 147.70. That's the biggest one, but you've got to know that you get what you pay for. These are designed for folks who rarely, if ever, go to the doctor. So you're getting money back on your Part B premium, but in turn, you're having to pay higher copays, higher maximum out of pockets. If you go to the doctor, if you go to the hospital, if you have an MRI, all those expenses are higher. So this is appropriate for a very small segment of the population. If you're just turning 65, you're in great health, you're 66, you went to the doctor once, maybe last year, this might be a good plan for you. But if you're 75 and you go to the doctor 6-10 times a year, this is not the plan for you. Okay, so you get what you pay for. There you go. Medicare Advantage 2025.